My name is Martha Shanahan, and I'm Director of Community Benefit for St. Joseph Health in Humboldt County. What we do in community benefit, we feel a real connection to the history and the heritage. We feel connected to the Sisters of St. Joseph who came to Humboldt County in 1912 and set about to serve the dear neighbor without distinction. We walk in their footsteps and we carry on the legacy that they left for us. We continue to work in the community to identify needs and try to work with partners and other like-minded individuals to meet the needs of vulnerable populations living in our community. We have 5 programs in the Community Benefit Department that meet an identified need in the community and serve vulnerable individuals. The Community Resource Centers are one of those programs. We support 5 Community Resource Centers in various parts of Humboldt County: Willow Creek, Blue Lake, Eureka, Lolita, and Rio Dell. Each of those resource centers is similar in mission and purpose, where they're a place-based center where vulnerable folks who are facing a hard time can connect with needed resources. But each center is unique to the community it serves.
We provide a variety of services down here at the Community Resource Center, but I think one of the most important ones is taking the opportunity to listen to the stories of those who are, many of them, suffering from homelessness. Taking the opportunity to hear their stories, to understand where they've been and where they want to go. We all have hopes and dreams, and it's important to remember that they're people just like anyone else. And by getting to know them, we can better understand how we can help them.
We get to serve the community. We get to balance the needs of the individual and the needs of the community. We have a lot of people who come through who are very vulnerable. We serve a great number of people who are homeless or traveling.
I feel like with the Resource Center, the work I do is a connection, because in a sense, we do it together. Somebody doesn't walk in and I say, here you go, take off. It's a conversation, it's an interaction that we have together.
We are so lucky that we have a huge pool of volunteers. We have close to 30, and most of them are seniors, retired folks that would like to help out in the community, and we have plenty of opportunity. They help us with Commodities Day, and they help in the garden. They help us at playgroup. They help with all of our community dinners. So we value our volunteers so much, and it gives people an opportunity to give back if they've been a client here, or just to give to their community that they live in.
Care Transitions is another program that we have in community benefit, and this is a great example of a multidisciplinary team working to provide intensive case management services just after a hospitalization. We have a medical respite arm of Care Transitions, and our multidisciplinary team of a nurse, social worker, and health coach provide intensive case management for the first 30 days after a homeless person has been discharged from the hospital.
We have 2 respite facilities. We have the Healing Ring and the Betty Chin House is our newer one. And these facilities basically provide an opportunity for our homeless population who end up in the inpatient side of our hospital. They've just had a long hospital stay, maybe a major procedure, and they need somewhere to go to kind of heal, to get back on their feet. It provides an opportunity for me to swoop in and help them look for some housing options. Maybe we get them an ID, maybe we find them a long-term case manager, just whatever we can do in kind of a small amount of time to get them hooked up to some services and working towards getting off the streets and pursuing better health.
Care Transitions also has a service line that works with folks who are using the emergency department on a regular basis.
The biggest thing for my department that may come as a surprise is how many different hats the care transition team can wear. They don't just deal with our high yield patients. Because they have so many resources, they really know how to get us what we need. And in the ER, we're really good about saving your life if you're dying, but we're not so good about knowing what medication is covered, or what office will see you, or what programs there are for your older adult or somebody who might have specific psychiatric needs.
Our little department has all of these areas that do just great work with the community centers, and my program, the Care Transitions program. So I just feel like it's one part where the sisters have really tenaciously held on to their mission in terms of serving the poor and serving the underprivileged, and keeping that as part of what the hospital does. So I just feel like it's a privilege to work in this department and be part of this team.
Paso Paso is another community benefit program. It's a special one. It started out of an identified need in the community where Spanish speakers were delivering babies at St. Joseph Hospital without much preparation or education for labor and delivery. So a midwife partnered with one of those Spanish-speaking moms and started teaching childbirth education classes in Spanish. At the time, no such thing existed in Humboldt County. And over the years, as we've had a growing Spanish-speaking population, the services and the outreach that Paso Paso provides have grown as well.
We have a series of 4 classes. So today we're going to be focusing on the nutrition and stress management and preparing for labor.
Today they teach over 100 classes in Eureka and Fortuna. They still provide childbirth education, but they also provide breastfeeding support, parenting education, support groups for moms and dads, and a class for parenting teenagers. Healthy Kids Humboldt is another community benefit program that started as a community-wide collaboration with the intent of really making sure that kids had health insurance and access to care. In addition to access, they also help their clients navigate what can sometimes be a very complex and intimidating healthcare system. From making appointments to understanding how insurance works, Healthy Kids Humboldt really walks with their clients through the healthcare system every step of the way. Evergreen Lodge is another community benefit program that occurred because a group of dedicated community members came together to try to meet an identified need in our community. Evergreen Lodge has 14 units and 4 RV spots, and folks who are undergoing cancer treatment at St. Joseph Hospital can stay there for very low cost or no cost, and it's a wonderful asset to our community. So it is truly a privilege to be able to work in community benefit. The folks in our department are making a difference in the lives of some of the most vulnerable people in our community every single day, whether it's through a connection or a kind word or supportive services or listening. Sacred encounters happen all the time, and that's what makes the difference in the lives of others.